The baby. Okay. Good morning, everyone. My name is Ann Williams Isom, and I'm the Deputy Mayor for Health and Human Services. And the mayor doesn't know this, but this is a very special speech for me and a very special week for me. My oldest daughter is getting married on Saturday. It's been very interesting, all of the emotions that I've been having. So while we go to pick up the wedding dress this afternoon, I can't help but think about my ancestors and all of the women in my life. My mom, my 92-year-old mom, who I would have wanted to be here today, but we're trying to keep her safe to get to Saturday. And all of my grandmother and all of the women that have brought us to this moment. Today, we're talking about women's health. And I think I've told this story before, but my grandmother died in childbirth with my mom. So when we talk about in New York City in 2023, that still 9 times, it's more likely for an African-American woman is 9 times more likely to die from a pregnancy-related complications, it's personal to me. When I think about my own personal history with my body, I think about that soon-to-be married woman who I had bad postpartum with. And y'all know nobody likes to see a pregnant woman or a woman with a baby that's not happy. So no one wanted to listen to me. If it wasn't for my mom, who's a midwife and a nurse and was with me, I don't know how we'd made it through. I had trouble breastfeeding Ayanna too. And everyone looked and acted like it was my fault that I had trouble breastfeeding. I had a miscarriage after Ayanna. No one really wanted me to talk about it because what's the big deal? You already had a baby. Fast forward, I had the news a couple of years ago in 2018 that no one wants to hear. I had cancer, and I had breast cancer. And the way that the nurse and the doctor told me was kind of horrendous. And if it wasn't for my husband being there so he could kind of stabilize me, it would have been a horrible situation. When I realized that I had to have a partial mastectomy, I was like, what? I just thought I had cancer and maybe I'd get radiation, but I realized that I was gonna have a partial mastectomy. My friends acted really strange. They acted like I was gonna change because I was gonna lose a breast. I didn't realize that I was my breast. I thought I was pretty fine already, and so I thought I'd be fine already afterwards. But I realized that what they were saying was how the world would look at me would be different if I had a partial mastectomy. Fast forward to the wonderful and joyous challenges of perimenopause, menopause, and postmenopause, and trying to lose these extra 5 pounds for this wedding gets more complicated when you're 58 years old. But what I want to say is that all of that is important. All of us, all these women that are going to speak today, I can imagine have similar stories, similar places where they didn't feel seen, where they didn't know if somebody would listen to them. And that's why it's so important for us to have this conversation today. But let me say this. People are going to write a lot of things about this administration. People are going to write a lot of books about this second African-American man and mayor and this 110th mayor. But what I want to say is that I am so happy that I'm going to show up in this chapter about women's health and to have this mayor who came to us to said, I think we should talk about vaginas more. I was like, what? What do you want to do what now? He never ceases to amaze me. I am so proud to be a part of this administration. I'm so proud to work for him. And I'm so proud to have a man and a mayor who sees us for who we are. And I'm so proud to live in a city where my daughters will have the future that they need, and that my granddaughters, maybe, I'm not saying that my daughter has to have a baby, she can do whatever she wants. I'm just saying, if in the next couple of years I happen to be somebody's grandmother or great-grandmother, I want the world to be a better place. With that, thank you, Mayor, for all your leadership. And now let's bring up some of the strong and, can I say, badass women that are here with us this morning. I'll start by having Dr. Michelle Allen come up. She is the Senior Vice President and Chief Medical Officer at the New York City Health and Hospitals. We want to talk to you a little bit about our whys, why we do this work and why this work is important to us. Dr. Allen?
Thank you, Deputy Mayor. And I must say I'm equally proud to be part of this day, calling attention to the needs of women that have been ignored for so long. In terms of why I do what I do, as you heard, I'm the Chief Medical Officer of New York City Health and Hospitals Corporation, but I'm also an obstetrician and gynecologist. And in choosing OBGYN as my career path, it was important that I marry my love for medicine with a political commitment so that I could answer the question to myself, why was I in medicine in the first place? That personal commitment would need to sustain me beyond any personal achievement or gratification. And that personal commitment was, and still is, to provide, as Deputy Mayor said, to provide all of us women the personal, informed, compassionate, and excellent care which I could not find myself as a consumer of women's health. Thank you.
Thank you, Dr. Allen. Now I would like to bring up Dr. Wendy Wilcox. She is the Chief Women's Health Officer at New York City Health and Hospital. Dr. Wilcox?
Thank you, Deputy Mayor. And thank you, Mayor Adams, for this really momentous occasion. I'm really proud to be a part of this event. My name is Dr. Wendy Clark Wilcox, and I'm going to say my maiden name because without my hardworking and dedicated parents, I never would have been able to become a physician. Why did I choose to become an obstetrician gynecologist? Well, I went through my medical school rotations, and I had the privilege to be included in the birth of a young family's child. And after that experience, I'm so sorry, but there was no going back. I knew what I was going to be, and that is why I stand before you today as a board-certified obstetrician gynecologist and Chief Women's Health Officer for New York City Health and Hospitals. When I was having my own children, who are now grown, I knew a little too much. I was so excited, but I also know that things could go wrong, especially for people who look like me. And so, thankfully, everything went well and we were all healthy. But really, after that experience, I realized that it would become my life's work to change the trajectory, to work on health disparities, not just for women and girls, LGBTQ and non-binary people, but for all people. We have to change the paradigm and dynamic. And so I'm proud to stand here with Deputy Mayor Isom and Mayor Adams as we work on this important work to improve health equity and healthcare for all people. Thank you.
Thank you, Dr. Wilcox. Next, I would like to bring from the Department of Health and Mental Hygiene, Assistant Commissioner Dr. Zahira McNutt. Did I get that right, Dr. Z? Ooh, I did it right.
Hello, great to see everyone. Thank you all so much for being here. Thank you to the mayor and to the deputy mayor and to my colleagues. My name is Zahira McNutt. I'm the assistant commissioner for what's called the Bureau of Brooklyn Neighborhood Health in the New York City Department of Health and Mental Hygiene, where we focus deeply on disinvested neighborhoods across the city. I am originally from the 1980s version of the Lower East Side, and my earliest experiences, I like that you love that, yes. My earliest experiences or positive exposures to health and wellness were wrapped up in the power of community. We were centering our own courage, quite frankly, and our own ability to solve problems in the absence of supportive systems. My earliest negative experiences in the same neighborhood were a result of discrimination and failed systems. Health clinics that lacked resources, unsafe play areas, outdated textbooks, high levels of substance use, and homelessness right alongside vacant buildings. This lived experience called me, like many, to seek justice in public health. And I'm glad that the mayor is centering investment in women's health specifically today, because so much of what we get wrong limits the possibilities for women and girls and results in intergenerational harm. We have unlimited opportunities ahead of us to get this right. And I look forward to collaborating with the mayor, our city agencies, our powerful community-based organizations, and others to improve the health of women in the city of New York. I thank you so much for your time today.
Thank you, Dr. Z. Also from the Health Department, let me now bring up Dr. Leslie Hayes, who's the Deputy Commissioner for Child and Family Health.
Good morning, everyone. Good morning. It's great to see all of you, and it's great to be here with you as well. As you heard, I am Dr. Leslie Hayes, the Deputy Commissioner for the New York City Department of Mental Health and Hygiene's Division of Family and Child Health, known as FCH. I am an adolescent medicine specialist by training, and I joined the health department in mid-October of 2022. So I am, as they say, brand spanking new. Why do I do what I do? Growing up in Harlem, my mentor was my pediatrician. He was an African-American male who was a public health advocate, as well as a social justice advocate. And I wanted to be just like him. He went on to government after serving 30 years in private practice in Harlem to work with the Johnson administration around areas of lead poisoning and infant mortality. And as I said, I wanted to be just like him. I went on to do my residency training at Children's Hospital in Washington, D.C., and lo and behold, not knowing he was on the board, he came downstairs, he greeted my parents and myself, and he talked about how proud he was that his peanut, and I'm not sure why he called me peanut because I was not premature or anything of that nature, had did exactly what that I said I was going to do. So I joined the health department, as I mentioned, in October of 2022, because I wanted to be a member of a team that focuses on reducing health disparities and advancing equity on a wider scale than what I could do as a solo practitioner. I come from primary care, where I was seeing patients primarily in outpatient settings and doing work in a way to help reduce disparities, but not at the level that it happens at the health department. So from things like the new family home visits, which set families up for success at the beginning of their life, to the abortion access hub, which connects callers in New York City and other states to medical services, FCH and the Department of Health have programs like this that are improving the health and the lives of families, children, and women. And that's what I want to be a part of. And that's why I do what I do. So I thank Mayor Adams and his administration for this opportunity to serve and work on the women's health agenda that is going forth. Thank you.
And speaking of brand spanking new, I just want to give Caesar a shout out. His mom, Annalise, works at H&H. We were on a Zoom the other day and we were like, is that a baby in the background? Bring that baby out to us. So thank you for joining us. Next, I'd like to take a moment to have Priyanka John, co-founder and CEO of EV, come and say a couple of words for us. Priyanka?
Hello, everyone. I'm Priyanka Jain, the co-founder and CEO of Evie, a startup based here in New York focused on closing the gender health gap, starting with vaginal health. I started Evie after a lot of my own journeys of going to too many doctor's appointments, being told that maybe I should drink more water, maybe I was too stressed, maybe I needed to sleep more. And as I dug into the research, I found out the crazy stat that Mayor Adams shared with us earlier, that women weren't required to be in clinical research in the US until 1993. And that is when I quit my job and decided to start Evie. As we heard from Mayor Adams earlier, the status quo in women's healthcare is unacceptable. And it's clear that real change will require all of us, as we see here today, across policymakers, doctors, researchers, institutions, patients, and innovators, if we really want to pave a way towards a new and better future. Days like today remind me of how grateful I am to be building Evie in New York City. Not only is it the hub of the world's leaders in research and medicine, but it has become the undeniable hub of my startup peers innovating in the women's health space. We are so incredibly excited and grateful to be partnering with the city leadership that can make New York City truly the model city for women's healthcare everywhere. And now, with the city leadership finally committed to truly improving access and outcomes, we will finally have the opportunity to build a future of women's healthcare that we all deserve. Thank you.
Thanks, Priyanka. And also thank you to all of our allies and folks and women, strong women that are here with us today. Give yourselves a round of applause. And speaking of allies, I'd like to turn this over now to Mayor Adams, who we also call one of the men who get it. Mayor Adams.
Thank you. Thank all of you. And I don't know if I see Antonio Reynoso, who, if he's not here, the Brooklyn Borough president, who has committed all of his capital dollars to maternal health, and he's building out hospitals. So there's a clear, we're at a very unique place and a clear place to deal with these issues. And I'm really proud of this moment. This is one of the items on my list that I checked off for the commitment with my mom, who went through some serious healthcare crises and did not get the support, and my two sisters, and the women who really played a vital role. And I remember even conversations that Tracy shared about her encounters going to the doctors. So there is just this hidden secret that women have suffered silently, and they really felt that no one heard them, but I did. And it was part of my entries in my journals that when we get here, we were going to tackle this head on. And I just really believe that at the heart of this conversation is our failure to just want to engage in the conversation. Being the woman body is just taboo. No one wants to talk about it. I think that, moms tell their daughters not to talk about it. We keep it a secret. I'll never forget when I was talking about a menopause-friendly environment in Brooklyn Borough Hall, and all the women came to me and say, please don't mention that, don't talk about it. I mean, we can talk about erectile dysfunction, but not clitoris stimulation. Something is wrong. Something is just wrong. And we just have to stop doing that. And if we just start having a conversation, the beauty of the physical anatomy of a woman and how it should be talked about, shared, and discussed, and we should not just treat it the way that we've treated it for years. So we're going to lean into that. I'm just hoping so much that as we did our speech and as we talked about this, that people had to spit out their coffee, that they had to squirm in a chair, that they had to feel uncomfortable, because discomfort will bring comfort for the women who have been had discomfort throughout their lives. So we'll open up to a few questions.
How are you? Good. First question to you. Can you speak a little bit about the details regarding the medication abortion expansion? How many clinics will that go to, and who will be able to access?
One of our teams, Dr. Fasani, is one of our... Okay.
So thank you for that question. The medication abortion clinics are going to start tomorrow. Will be the opening of the first one at the Morrisania site in the Bronx. And then others will be rolled out after that, Jamaica Hospital, Central Harlem, and then I believe one of the Fort Greene. Thank you.
And so that will be 4 to 5 clinics to start with? I mean,
Yes.
by the end of the year, what will the total be? And then how will somebody coming in that wants that medication abortion pill be able to access it?
So there are scheduled appointments, but we do take walk-ins. As far as rolling it out, they're going to be rolled out throughout the year in those clinics that I just mentioned. And you can come in between Monday through Friday They're open, the clinics open at 8, and they have a session from 8 to noon, and I guess another one until 5 p.m. And they will be assessed by a physician and then move to be given their medication. And I think that,
I'm sorry.
Go ahead.
Yes, so New York City New York City Health and Hospitals, we're already doing medication abortions at all of our outpatient facilities that are in our hospitals, and we offer the full range of abortion services, surgical as well as medical. Thank you.
Just a follow-up, how many clinics in total will be offering medication abortion access by the end of the year?
We have 11 in New York City Health and Hospitals, and you have 4.
Expansion, oh, I see, so it's 11 already, expanding to 4 sites.
the ones in the Bronx, and then the other 3 will roll out over the next year.
Can you tell us just anecdotally what the demand for abortion pills has been?
Within health and hospitals, there has been a significant demand. And certainly offering the full range of services, we would offer patients, you have an option to have a surgical abortion after 5 weeks, but certainly a medical abortion, it can go up to 11. And so within that range, a patient has many options of what they would like to do. And we certainly talk to patients and find out what their preference is.
Julia?
Yes, and to follow up, what is the care for the medical abortion? Is it outpatient? Is it overnight? And is this open only to New York City residents or anybody?
So the care is actually pretty easy. There's no hospital stay required. We certainly give patients the full range of instructions of what to look out for, and certainly concerning signs or symptoms that they should access an emergency room location. I'm sorry, what was your second question? I don't remember.
If there was open to anybody or New York City residents only?
So,
Sorry, I can answer. Sorry to, I know that I'm lacking a chromosome which is why I was at the top of the stairs. So I'll just be cognizant as I answer this question. Well, so Dr. Wilcox is right. Our public hospital system, which runs on reimbursable health care, has been offering medication abortion. Our sexual health clinics and our DOH clinics, which are free at the point of care without billing at this stage, are opening up the first fully city-funded clinics in this regard in the country. So this is city dollars going to this specific purpose, and we're the first in the nation to do that. When they're all up and running, these 4 sites can deliver up to 10,000 medication abortions a year, and that's on top of what our public hospital system already does. And why did we do this? Because it's clear that, as Dr. Wilcox said, medication abortion has been offered through our reimbursable healthcare system for some time, for years. But there are barriers to entry with that system, right? There are barriers to entry, even if we say we will provide care free of charge, regardless of ability to pay. We see that there are social, cultural, and non-economic, if not economic, barriers to care, which is the crucial role that our city health department public clinics play in filling those gaps for the most marginalized.
Will New York City residents only be eligible, or is this open to anyone?
This is open to anyone, much like our abortion access hub. So our abortion access hub was the first hub in the nation to connect people seeking abortion care from any one of our 50 states to care, support, logistical support, social support, housing, transportation here in New York City, which is a consortium of city services, city-supported sites, as well as our network of incredible nonprofit providers like Planned Parenthood and so many others that currently provide the bulk of abortion care in New York City.
Assuming there'll be an influx of people coming for this care, where do they go, where do they stay, and who pays for that?
Well, this is part of what the Abortion Access Hub is all about. It's about arranging those specific needs in a very person-centered way. So there are people who may come to our city who have family members who have support. There are those that may require that kind of support. The city council has wonderfully, and I see that Councilmember Schulman and Menon are here. The city council has set up an abortion access fund locally to support people who need social and economic support. Our nonprofit providers have that support as well, and the city is also supplementing that.
I guess it's a two-part question. A few years ago, there was a council bill, I just see Chancellor Banks, that provided free pads and tampons in city schools. I wanted to know if that is still happening, and would it be expanded to other buildings? Because I haven't seen it in city schools, and that was one way, I guess, to make the city buildings more friendly to women.
I'll defer that to my colleagues in education, or we can get, you want it? We can get that answer.
Would there be, I mean, I don't know if the mayor supports expanding it, if it's putting it back in the schools, if it doesn't, and then also maybe expanding it to other buildings.
Yes, so let's find out exactly specific what you're talking about, and then when it comes down to expansion in this area, this is what we want to do, and this is the purpose of this. And so Chancellor Banks will get the answer to that question for you.
Morgan, more on the abortion hill. This has been around for so long now. What have been some of the roadblocks in supplying this to city-run clinics? Because it's my impression that this was already kind of happening. I think for a lot of women, they probably assumed that this was already available.
Well, and I think this gets down to some of the core aspects of how healthcare is funded in our country and how we set up barriers, even unintentionally, to accessing care that make it hard, especially for women and people seeking abortion care, in an environment where that kind of care is extremely stigmatized and discriminated against. Even here in New York City, culturally, we are a safe haven. We have set that out, but there are still these barriers to care, especially for the most marginalized. And what we're saying today as a city government is that we're centering this issue, and we're going to tear down whatever remaining barriers there are. We're going to build upon the access to care that we have in our public hospital system. We're going to supplant that with our public clinics, our truly public clinics that are walk up, all access, regardless of, we never take a single question about your insurance or your status. And that has played and has historically played a really important role in the city in providing care and sexual health services to people who often are pushed through the cracks of our reimbursable healthcare system.
Was it just reprioritizing the money to this in order to get this done?
No, we as soon as the Dobbs decision came down, this mayor and this administration and OMB came together and said, what are we going to do to set this city out as a leader in this nation? So this is new investment, new resources combined with funding that we already have.
Yeah, you said this medication abortion expansion will be fully city funded, so what's the annual operating cost of that? And then I also have a question for the mayor.
We can certainly get back to you with a budget number.
Awesome, okay. And then what specific policies related to women's health are you going to call on the governor to include in the upcoming state budget, given that the state oversees most healthcare organizations?
The governor has been a real partner on this issue, as you heard at her State of the State. She talked about the issues, particularly around mental health. And what we are going to really lean into is how we dealing with the mental health aspect of having a child, mental health aspect of even postpartum, as we've learned so much about, even my days at Borough Hall, and also something that's often ignored, those mothers who are dealing with substance abuse issues. And that's where we're going to really speak with the governor on these issues in these areas of concern. But we also want to build on what we're doing already, what we're doing with our doulas. This administration in the previous years, as I announced in our speech, we've done so much in this area. Now we're taking it to the next level, the summit that we're going to hold with a host of people who have been working in this area to come up with a real solid agenda. And the governor, again, has been an amazing partner in this area, and I think she's going to continue to do so.
Thanks. Yeah, I just wanted to get a firmer sense of the timeline. So do you have a date for the summit in March? And when will the subsequent, suite of policies be presented? And will they be proposed in time to be
there's some things we can do right now for the state budget, and there's other things we're going to learn after bringing all the experts in the room all across the country. We're looking for everyone to be engaged, and there's going to be a list of policies that we're going to roll out after getting folks in the room. We did not want to dictate. It's time to really hear from those private, nonprofits, medical experts who have been talking about this for years. We want to get everyone together to resolve that. And then we're going to produce a document based on what happens at the summit. The summit is during Women's History Month. We're making this announcement now to really set the course and really open this up to the entire country, if not the globe, to say we want to bring your experts here to the city so we can finally move forward on this important agenda.
Mr. Mayor, you mentioned something about menopause accommodations
Yes.
for city workers. I was wondering if you can give us some examples of what kind of policies you're thinking about rolling out.
You know, menopause is something that we've ignored for so many years. It's about your work schedule, your sleep patterns change, everything from, you know, why you need that air conditioner on right now because your body temperatures are changing. There's just so much that goes into it, and the way to better to address it is for us to properly study it. And the way we properly study it is to properly acknowledge menopause is real, and so many people are dismissive of it. And so what we need to do in the area of policies is going to come based on putting it front and center on exactly what are the different dynamics of it and what do we do to adjust, how do we operate in our city for women who are going through menopause or who have gone through menopause. Okay, all right, we're gonna do a few off topics. Thanks, everyone. Thank you. Thank you. Yes, yes, yes. Thank you. Thank you.
It's really important. So thank you for this.
Thank you.